Good afternoon, everyone, and thank you for Zooming in with us today. It's really great to have you with us. I am Ruth Katz, co-director of Aspen Ideas Health and executive director of the Health Medicine and Society program here at the Aspen Institute. I'm delighted to welcome you to another Aspen Ideas Health 2020 virtual event. Now, while the COVID pandemic has prevented us from gathering in person as we always like to do, we are excited to continue to host informative and inspiring conversations with leading health practitioners, advocates, artists, scientists, and innovators. And we couldn't be more excited about today's program, focusing on innovative strategies for building a new, equitable U.S. healthcare system. So let me jump right in and introduce our very, very special speakers. Peter Long is the Senior Vice President of Healthcare and Community Health Transformation at Blue Shield of California, where he leads collaborations with healthcare providers, community leaders, and other stakeholders to design innovative clinical and community programs and healthcare delivery and payment systems that provide all Californians access to value-based, high-quality care. Previously, Peter was president and CEO of the Blue Shield of California Foundation, where he helped launch the California Affordable Communities for Health initiative in 15 communities in partnership with the California Department of Public Health and other philanthropies. Peter also serves as an adjunct professor at the UCLA Fielding School of Public Health. Alexis Trinity is a community-based researcher and director of projects at Marnita's Table, a non-for-profit organization focused on inclusive community decision-making through intentional social interaction. At Marnita's Table, Alexis is responsible for project design and implementation, evaluation, and oversight of the organization's grant-making activities. Previously, Alexis worked as an educator and community arts organizer and served as a researcher with the Women's Writers Project, Human Rights Watch, and the Stimson Center. Alexis is passionate about intentional community building, rights-based advocacy, and collaborating to create more equitable and humane systems. And finally, Emilia Hardy is the Vice President of Strategic Initiatives on Best Buy's Inclusion and Diversity team. She has over 18 years of leadership experience at Fortune 100 companies. Emilia is also actively involved within her community, where she serves as the champion for the Black Employee Research Group, as well as the Women's Employee Research Group at Best Buy. She sits on the board of directors of the Twin Cities Boys and Girls Club and Minnesota Community Healthcare Services. Emilia is an innovative and transformational business leader who leads with a combination of out-of-the-box thinking, which we love at the Aspen Institute, and robust operational acumen. With that, we want to thank Peter, Alexis, Emilia for taking time from their very busy schedules to join us today for what undoubtedly promises to be both a very timely and a very interesting and informative discussion. And of course, thanks again to all of you in the audience for being with us. We look forward to seeing you soon for our next Aspen Ideas Health event. A final thanks to Peter Long, a longtime friend, and to Blue Shield of California for your wonderful partnership. Peter, as you know, it's always a great, great pleasure to work with you and your team. Thank you all for being here. Peter, the Aspen stage is all yours.
Thanks very much, Ruth. What a pleasure to be on the Aspen stage, real and virtual. So welcome everyone to this conversation. We're really looking forward to this dialogue today about the future of health and health equity in the United States. As we all know, the COVID-19 pandemic, combined with community uprisings fighting for racial justice, have presented us an opportunity to radically rethink healthcare and health equity in the United States. The Foresight Initiative is a nationwide effort to envision and create a new future for health. It was created to move these important issues forward. So today we're going to talk about some of the findings from the public opinion research, community engagement, and hear what are we learning from a diverse set of individuals and communities across the United States. And we'll hear where we're going next. How do you take those learnings and insights and turn them into action to truly transform healthcare in the United States? We believe this is a moment of opportunity. Others have described it as a wet clay moment where we can actually reshape and rethink the healthcare system. And I think for someone who's been doing this for 25 years, that is a unique opportunity that I've seen in my lifetime to really make some fundamental changes. So I'm really excited to start the conversation with Emilia and Alexis. Welcome. And I'll start with you, Emilia. If you could share with us a little bit more about the Foresight Project. This is a project that's been happening for a little while now. Share with us, what's your goal? What are you trying to improve? You are one of the co-leads of this project nationally. We thank you for leading us in this effort. And in particular, I'd love for you to talk to us a little bit about the game changers, some of the scenarios that the Foresight Project has developed to help communities think about a different future for health and health equity in the U.S. Welcome.
First of all, thank you for having me. Good afternoon, everyone. I think to build upon what Peter said at the introduction of this is that we are in a time where COVID and all the racial trauma is showing us the exacerbation of disparities for BIPOC, Black, Indigenous, and people of color. And so I think Foresight, which Peter said is a national collaboration of nonprofit, for-profit, all those with a focus on health, is apropos and right on time and relevant for what we're trying to do. And when you're trying to imagine how you create a society where healthcare is accessible to all and you don't see these disparities when we have things such as a national pandemic, or even when we have chronic illnesses that impact one community versus another, you have to look at all of the things, all of the trends, all of the challenges and things that are impacting our health and well-being. And that is where the 70 futurists for the Foresight Project, or the Futurists for Foresight's project, came together and came up with over 70 trends that really impact our social determinants of health and how we live our lives. And the top 9 that came out of that are environmental breakdown. So you think about all the climate change that we're having, the global warming, and natural disasters, forest fires, all of the hurricanes, the things that we're dealing with, and how that impacts health. You're looking at Louisiana being already ravaged by COVID, and now again being ravaged by hurricanes and natural disasters. All of that impacts your health and your accessibility to the proper health care. You look at synthetic biology and engineering new life forms, or just using science to help us find equitable health solutions. And then machines. Machines are automating things. We have artificial intelligence. I know Best Buy is big at how do we do telemedicine? How do we help people who cannot go into the clinic access healthcare through Wi-Fi, through the internet, through wearables, through the cameras. We also look at the rising of competing points of view. We're struggling with our identity. You know, where do I stand? What is my truth? I think everyone's asking which way is up, which way is down, where do I fall in all of this? And that brings stress and confusion and can really impact the health as well. We're looking at digital fabrication. How do we customize things so that it addresses each individual's needs? New economies, how do we have collaborative and equitable economies? Sometimes capitalism, you have winners and losers. How do we keep from having those losers and we have a more equitable division of resources? And looking at privacy and data and the right to self, who accesses and controls your data, even your health information, which is very personal. We also look at the rise of authoritarianism. Sorry about that, that's a mouthful for me. But it's really about the shift in isolation attitudes that demonstrate the rise in authoritarian governments. And that means like greater divisions, who's really in control, and where do we feel the power should shift? Is the power with the masses? Is it with the few? Where does the power lie? And then the rise of self-organized citizen movements is the last a top 9 game changer that came out. And that really is, we're seeing this in the protests and people rising up and forming their own movement. So all of those things really, some of them sound like they don't impact your health, but they all do impact our social determinants of health and all those things that lead to a healthy lifestyle and a healthy well-being.
So one of the things, Emilia, when we originally set out, we were thinking about 2050 for some of these. These are large-scale trends that you described, things that literally are moving through our society. And it's been striking, I think, if you could comment a little bit on how many of these factors actually have come into play in 2020. So as I said, we intended these in the Foresight Project to be helping people to deal with abstraction and deal with things that might take place in a generation or more. And what's been fascinating, as you in your introduction, is just how many of these trends are actually converging and appearing so much sooner than we had thought. I mean, if you have any thoughts on that, then we'll turn to Alexis to hear how people have actually processed that.
Yeah, I think one example when we, again, machines, automation, digital fabrication, even privacy and data, when we think about telemedicine, even I would say 7 or 8 months ago, that's where I was working on the health team at Best Buy. I mean, it was a hard sell really to get anybody to adopt telemedicine, whether it's healthcare providers or patients feeling comfortable with even having a conversation with your doctor. Everyone felt like I need to see someone in person so that I can have a credible healthcare experience. And overnight, look what happened. I mean, I think 90% of my own healthcare appointments are now virtual, and I couldn't imagine it any other way. And the same information, we're also just using other tools. We're using wearables and patient monitoring devices to get data to healthcare professionals so that they can assess you from not being in person. And you know, that stuff is completely automated. We're using machines, artificial intelligence, the dissemination of information, the protection of your healthcare information. So all of that, it was, yeah, we're getting there, we're moving there. Telemedicine might have a high adoption in 5 years maybe, and now COVID overnight has changed that and turned it on its head and accelerated 5 years into 18 months to 6 months to 2 months to 3 months. So all of these trends are coming fast and furious, even more so than we thought they would, and we have to be prepared and introduce them in a way that is equitable and accessible to all.
So with that, thank you. With that, Alexis, part of the project then was to take these scenarios and trends that have been accelerating and converging in many ways, emerging and converging. And what we really wanted to do is go out and speak to communities, families across the country and understand how they're experiencing it, but also how they see the future and how they want to co-create and develop the future. So Alexis, if you could share, you're within a really fascinating organization, Marnita's Table, that does deep, sustained deep community engagement and really community engagement to drive action and inform action. So if you could share some of what you've been doing and how you've been engaging with communities across the country and what you've been learning.
Absolutely. Thank you, Peter. And thank you, Emilia, for your comments so far. And to all of you who are calling in today. I think this is such an important conversation. You know, and we started designing these resident engagement experiences last fall, very much with the intention of being in person and making it embodied, and certainly with our priority focus being on ensuring that we had really, really diverse conversations, not just in terms of language and culture and race, but also in terms of experiences with abilities, differing abilities, and socioeconomic status. We wanted to get people who had rural experiences and perspectives to share, and people who could share suburban and urban and every combination in between. You know, and I think when we pivoted in March, we really wanted to hold that. I think it became, you know, people are talking about COVID as the great revealer, and I think it became all the more urgent that we included a lot of these voices in this conversation at the same time that we needed to think about how are we going to bridge the technology gap now and make sure that, you know, people calling in from rural Alaska or rural New Hampshire are able to have the same quality experience as people who are calling in from, you know, urban San Diego or suburban North Carolina. And it's been really rich and it's been really interesting and challenging, but throughout this process, we've been trying to incorporate everything that we learn as we go. So we've actually prepared a couple of slides, a quick image to give kind of a snapshot here of where we've been and who we've been hearing from. This is very much still in progress, but so far we have been in California, Minnesota, Alaska, New Hampshire, Kansas, North Carolina. We're going to Connecticut next. So it's a pretty broad spread of places that we're visiting. We're working with a number of local philanthropic partners, which we think is super important because, to your points earlier, Peter and also Emilia, you know, community members are really excited to engage in this conversation, and also they're pushing us toward action. They're saying, what can we do now, especially in this, you know, wet clay moment, as you so usefully put it earlier, to ensure that we can actually make changes that address not just inequities that are being exposed by COVID, but longstanding inequities that have created the persistent barriers that we see and unequal outcomes across a range of health concerns and issues. On the next slide, actually, we have a little bit more detail as well. Here's a quick shot of folks in the room having this conversation, much as we are today, but on a little bit of a smaller scale. We've been doing multiple events in each region. And so far, we've actually upped these numbers. As of last night, we had another event in Kansas, but we have welcomed over 700 community members, over 70% of whom have been Black, Latinx, Indigenous, or other people of color, and about 19% of whom have been under the age of 24. And in fact, we have a couple of conversations coming up this fall with students in California that we're very excited about. I think another, you know, piece of this, and a piece that has been coming up front and center across regions in these conversations, is that folks are having an intergenerational experience that kind of connects to previous movements around rights, health, and equity. You know, we've had grandmothers say, I was fighting for human rights and for health equity back in the 60s and the 70s. And, you know, I don't want to see my grandkids still having to fight in order to preserve the beautiful wilderness or the natural resources of the lands around them. And I think having that kind of diversity, you know, and that kind of representation in the room has been really essential to the kinds of feedback that we're getting. So we've been having these conversations, not just in English, but also in Spanish, in Vietnamese, and Burmese, Amharic, Arabic, Somali, Swahili. We're always adding new languages. Actually, we're preparing right now to have materials translated into Khmer for our conversations coming up in Connecticut. And we've had elders come and share their experiences in Tagalog. So, you know, really, again, it's very much an iterative and emergent process. But there are some really interesting, I would say, areas of focus that appear in the conversations that we're having. Obviously, regionally, people are experiencing and thinking about health challenges very differently in certain key ways, right? I think in Alaska, we saw a lot of interest in natural resource preservation and a lot of concern about balancing people's economic needs and the local industry with the need to preserve, again, natural resources and to work toward having really equitable and affordable food systems, which is something that has been really interesting because people are talking about food systems and sustainable food systems and, you know, food sovereignty in a really interesting way, where they're linking it to being able to meet your basic needs and thinking about how certain systems have experienced intense strain under COVID. And people are asking these questions not just with respect to what's happening right now, but are also thinking very much about how do we build toward a future where solutions that we come up with now aren't just stopgap measures, but are something that can persist into the future and be built upon. So there are kind of three areas, I think, where these conversations have been picking up traction, again, across regions. And one of those, unsurprisingly, I imagine, is the need to meet your basic needs, right? Which seems so simple. And as Emilia mentioned earlier, there are a lot of things I think that fall under that people don't necessarily associate with health outcomes sort of just off the top. But people have been having this conversation when we ask them very explicitly, what do you need to see in the future to experience health and well-being? Not just as, target words or ideas, health equity, what is that? But what do you actually need for your family to be healthy and well 30 years down the line, for your community to be thriving 30 years from now? And a lot of people are saying, well, we've had these persistent issues with housing, with homelessness. We have concerns about behavioral health and wellness. We have concerns about transportation and jobs and the economy and access that isn't always equal. And, each region has a different perspective on it, but everyone has mentioned this, which again, I think to a lot in the health community, this is not surprising news, but one of the things that's been interesting is the way that people are explicitly linking this to issues of human rights and social justice. They're explicitly linking climate change to, what we can do around migration to be more inclusive communities, to what we can do around food systems, and putting it in the language of human rights, which is really interesting and I think very novel, and very much responsive to what's happening with COVID. If you think about, we went to Minneapolis, which is where I live and where our organization happens to be based. And we launched these conversations in May, the same week that George Floyd was murdered, and not just our neck of the woods, but the whole country and many parts of the world stood together in solidarity to push for a conversation around public safety that frames the discussion for the first time that I have seen, certainly, in terms of public health and public safety. And I think, what that taught us, again, to the issue of being emergent and responsive, was that we needed to make that an explicit part of all of these conversations. So we created space to bring local community context into each conversation where people could say, here's what's happening in North Carolina, here's what's happening in my neighborhood in Kansas, and here's what you should know about our communities, which, I think this is one of the things that's so important about community-based participatory research, is not just that it's building toward action, but that it's building upon the existing knowledge and resources and wisdom that exist in community as they are. Too often, I think it's easy to come from outside with a programmatic solution, particularly if you happen to have resources or the positionality to make decisions. And so many community members feel that they are already seeing seeds of community connection and support, of mutual aid, of alternatives to disappointments that they have witnessed in governance at the local or national level, or in government institutions. I think one of the things that's been really interesting as we watch this, moment of a loss of trust in political institutions, and the kinds of discourse that are happening around that, is that rather than taking the approach of allowing that to be a reason to step back and not be engaged, a lot of people that we have been speaking with are using it as a reason to do something now, to do something locally in their own communities, to connect resources, to think about what they can do on the job or off the job in their own neighborhoods. And again, I think all of this is very much responsive to what's happening right now. But it's encouraging as well, because if you think about, to take an example, food sovereignty, right? People are linking this to a rediscovery of indigenous knowledges and wisdom. They're saying, how can we use food as medicine if we can't afford healthy food? And so they're pushing us to have these conversations that I think are already happening for a lot of people in the health community and public health and health equity. But they're pushing us to think about what can we do at every level, individually as small community units, but also systemically at the policy level. And I think there has been a real call for systems folks, for decision makers, for community members themselves to be open to bold ideas in a new way, and to kind of embrace the discomfort that comes with that, given that we're in a moment where we, in some ways, don't have a choice about needing to be creative. To your point, Emilia, earlier about telemedicine, people have been responding, particularly people who actually work in public health, have been responding in these conversations saying the same thing, that they've been trying forever to get telemedicine incorporated so that they can reach elders in the community who are isolated, or so that they can reach particular populations and make healthcare more accessible. And there have been so many barriers and complications, But once it becomes necessary, or people feel that it has become necessary and urgent, all of a sudden new windows open. So I think those have been some really interesting highlights that are coming out, and we're learning. We're still, holding these conversations and analyzing all of the amazing things that people say. So there's kind of implementation and analysis happening at the same time. But it is very interesting that these seem to be kind of target areas where there's a lot of energy across the country in very different neighborhoods, environments, and communities.
Thank you. It's incredible, I think, to hear in people's real world and real lived experience what's happening. And I would just share, we went out in the Foresight Initiative a year or so ago with traditional focus groups and survey research, and people really struggled to imagine a different future. So I think the moment has changed clearly, and I think also creating the time and space and the opportunity to allow people to talk about what's important to them. And I think also introducing the game changers and thinking. So some of that, the combination of those things has really changed the dialogue. And I think that's an important point for this audience, that we did go out in 2019 and people really struggled. They could talk about universal health care, and they could talk about some very, I would say, tactical things, not food sovereignty, and not linking all the things in their lives and how they fit together. So I think that's just for me, it's been an observation. So Emilia, can you talk to us about, because I think we're in the Foresight Initiative, we're also doing other gaining insight and information from other audiences and using other means to fill out our understanding of what's happening and help to guide future work.
So I think that we are building on the game changers and the resident engagement feedback, and we will now be taking that into our national convening in this fall with about 100 participants, and those participants will be representing many different backgrounds and experiences. We will have policymakers, community members, commercial industry, and government, philanthropic organizations, and just all Americans that we can think of that would have a perspective on how do we bring this to life. And there we will be talking about, thinking about the game changers, thinking about what we're hearing from residents in the community, our own collective experiences. How do we solve for this bold, aspirational goal of creating equitable health and well-being for all, and not just some? And during that convening, we will talk about that, and we'll start to put into place what that vision could be of something that we could potentially bring to life. And I think the critical action item coming out of that is action, right? We want it not to be theoretical. We want it not to be just visionary, but we want it to become real. We want this dream of equitable healthcare and well-being to become a reality sooner than later. So that is what we will be doing to bring this to life, with many more perspectives, building upon the process that we already have in place.
Thank you. So Alexis, a question: you had mentioned the trends about basic need. What were you had mentioned 3. What were the other 2? The audience has asked, what were the other 2 trends, that the through line trends that you've been observing in the dialogues today?
So, yeah, one of the things that's been really interesting is that a lot of these are linked. And I think you mentioned earlier the game changers. I think that has been indeed a game changer in giving people permission to make these connections, I believe. And one area where this has really come forward is that people are talking a lot about what they can do outside of systems and institutions. So they're not just saying, here's a policy I need. Everybody talks about, insurance and affordability and healthcare for all in some form, irrespective of what they think about it. But what we're seeing is community members really opening this conversation up and saying, here, is my position, my decision point, my circle of influence, and what I think I can do, and how can I connect around that. I think so often we miss a kind of key point in moving from theory to action, from reaction to proaction, and I think that connection is relational, right? That change is relational, that social capital is the means by which we take our own ideas in our own tiny circles and broaden them so that our impacts have really enduring and meaningful change-making capacity. So people are talking a lot, again, not just about policies and what they want to see from providers, or even what they want to see from government and political leadership. People are saying, this is what I can do. This is what my neighbors are doing. And when we give them the opportunity to have these conversations, all of a sudden they see connections. We had one conversation where there were a couple of people who worked in homelessness and housing, and a person who worked in 3D printing, and they found this amazing connection, through it was suggested through one of the scenarios that we were using, but they were really excited that they were able to have this conversation in their own community with people who are doing work on different sides of a really complex and important problem, and that they could immediately see connections and solutions. They exchanged information so that they could go on and continue collaborating in their community. And we saw a lot of that as well, in many communities, thinking around, this is an interesting piece of it too, right? Because we don't often think about civic engagement or politics as a health concern, right? But a lot of people have been saying, we don't care what you do politically, but vote, like be counted, participate in the census, make sure that you are included and visible in our community. And if you're facing challenges on that front, how can we help to overcome some of those barriers? And again, I think at our organization, we often think about it as decision points, right? That, you can do something as an individual, you can do something as a family, you can do something as a community, a school, a county, and there are so many circles beyond that, right? That each of us has different entry points in. But if you are given permission, I think, to think about these problems holistically, you can bring your whole self to them. So that's the second one that we've been seeing a lot of energy around, tied directly to action. And the third is that, there have been these calls to consider big, bold ideas, and also calls to consider small and local solutions. I think we're seeing a lot of excitement around improving existing processes, resources. There are so many great programs where, people just don't have information about resources that exist, or where there are barriers that, are really technical and could be removed if we could have better communication around them. So things like, paperwork, so that people can get the behavioral health support that they need. We literally had a couple of conversations in different regions with people who said, I work in health, or I work in housing, I work in food security, and we have these resources, and we aren't always able to get them to the people who need them because of these kind of programmatic barriers. So there's a lot of interest, again, in rethinking what we have that already exists in community, and how we can better manage those resources to make sure that we create more opportunity and more access for more people.
Great, thank you. I'm going to go to you, Emilia, with a question from our audience. How do you see, so you talked about the telehealth as an example. Are there opportunities in a more digitized world, right, and in a COVID world, that we could actually address some of the health disparities or health inequities? The example that's given here is telehealth connections in different parts of the country, so we're not so geographically bound, and you could actually find linguistic concordance, racial and ethnic concordance, and opportunities, and leveraging this opportunity. So do you see within thinking through that, what are some of the opportunities? Start with you, Emilia, then Alexis, if you want to add to that as well. But
yeah, I think when you talk about lack of accessibility and making healthcare accessible to all, when you think about telemedicine, I think where it got its start is really in access to rural communities, where we're starting to see a lot of the hospitals close down and not enough doctors there. So when you talk about going into underserved communities, or talking about a distance from the next hospital or clinic, that is where we see telemedicine. Also for those who are chronically ill, who it's high risk to go into clinics and things right now because of COVID, or they're just not as mobile, they don't have transportation. that's another area where we see telemedicine really helping people to get access, because if you can't drive there, if you don't have a car, if you can get Wi-Fi, if that can be provided to you, or a telephone, then you can easily talk to a doctor and they can see you and help assess your condition. So I think there are many ways that digitization, machines, computers, wearables, any way that you can get diagnostic information about your health to healthcare providers from a distance, is really going to help with the access issue. And I think we just need to make sure, as we're dreaming this up, right, that we make sure that then everyone has Wi-Fi capabilities, and that we make these also devices affordable as well, or provide them to people so that they can have access to this care.
Great. So Alexis, there's a question that came in. I think you referenced a little bit, but you have been talking to individuals in very different communities across the country. So if you could give us, just illustrate one or two differences, or are you finding different? The question is, are you experiencing differences in different parts of the country, and just sharing with what that around health equity, healthcare.
Yes, absolutely. So a little bit of both in an interesting way, that there are certain things that people say everywhere. More human connection, people say that pretty much everywhere. That's something that will help them to be healthy. And I think especially in this moment, a lot of people are thinking about that. And certainly I think we ask everyone to show up in these rooms as their real selves and to bring their personal experiences and backgrounds and perspectives. And we don't really put any, sort of bounds around that. So we've had all kinds of political differences. We've had all kinds of socioeconomic differences. We've had people who are currently experiencing homelessness. We've had people who called in all together from a women's shelter. We've had people who are calling in on different phones or different screens with their elders or their grandparents in another home, and bringing those very different reflections and experiences to the forefront, certainly. Although, again, I think one of the things that's really surprising is that when you ask people what they need to be healthy, most people say a lot of the same things, even in very different circumstances. There are some funny instances. I know in Alaska, we had a really interesting conversation where, all over the country, we've been talking with people about food systems. And I think people are explicitly tying this to concerns about being able to access food under, that is healthy, that is locally produced, that is a sustainable system, and certainly, under moments of stress, of crisis, of social and economic shocks, people are thinking about this a lot more. But in Alaska, a lot of people said, hey, we are already off the grid. We know who in our neighborhood has extra generators, if the power goes out. There are times when we don't have access to the roads. And so we have food already stocked up. We know who's got, the winter stores that they can share with neighbors. And that was a very interesting and very different perspective, right, on the challenges of COVID. And what they were thinking about was the sustainability of their economic system, and talking about tensions between the mining industry and concerns about the very high value that people who live in Alaska often express with great pride about the land and the culture and the sense of community that they have around those beautiful natural resources. So, there certainly are regional distinctions that I think are really important. And at the same time, there are very clear and perhaps encouragingly human places of connection across all of that difference.
Great, thank you. So a question for both of you. This conversation has been about people's lives, mostly around the 98% of it that happens outside the formal medical care system, right? So a lot of the conversation has been about, and I'll actually ask two questions, and I'll give you a chance. You can take either, give you some A or B. One is language. And sometimes we go into social determinant language. Folks are in public health, and we begin to start to use language that folks outside of this world can't understand. So just some thoughts around this question A is around how do we make language that's inclusive and brings people in to the conversation, rather than saying, oh no, that's another social determinant conversation, the problem's too big, or that's someone else's issue. And then the second would be how given that this conversation has largely been outside of the formal, pharmaceuticals or hospitals and physicians, any thoughts about the intersection or the roles with the formal or the traditional healthcare system?
I've been speaking a lot, so I can just do a couple of quick thoughts on that note. I will say, first of all, so people have been having this conversation around social determinants without using the social determinants language. And I think one of the keys there, and something that we're always working on at my organization in particular, is taking the language and the ideas that we're working with to communicate this, to try to have this equitable conversation, and really simplifying it as much as possible. We always invite a multi-generational mix of people into our rooms. So we include very young children in this process, with their families and with the understanding that this is how you learn to be an engaged citizen and to have these conversations about what you need to be healthy. And I find that often we can combine, oddly, when you work in this space, you can combine jargon and really complicated language, very high level theoretical stuff, with an assumption that people don't really know what they need, or that they aren't making these connections right along with us. And I have found that part is part of the disconnect as well, because when we ask people, what do you need to be healthy 30 years from now? What does your community need? People have tons of ideas. They know very clearly what they need. And have ideas for how to solve those problems. They have ideas for, where those problems came from in the first place. And I think engaging in that conversation provides the opportunity to think about these big problems and take them and break them down into a more localized context. We may not be able to solve food security for the whole world, but we might be able to do something about food security in our neighborhood if we looked at our relationships and resources and renegotiated some things. And a lot of people really explicitly say that. And one piece that I did want to include in this, because so many of our first and second generation immigrant participants have said one of the big barriers that they face when interacting and interfacing with systems, with providers, sort of across healthcare areas, is language as a barrier. So many people said, we can't find doctors who speak our language. We had a heartbreaking story recently about a woman who talked about taking her mother in to get some medical help, and her mother, she wasn't able to be with her while she was speaking with the doctor, but her mother didn't speak English, and the doctor, and not just this particular doctor, but the whole hospital system didn't have someone who spoke her language. So they went and got a sign language interpreter, because they said they had to have an interpreter there, and it didn't matter what language it was, And so this woman tells us this story of trying to struggle to balance her own caretaking responsibilities with her mother's language needs in a community where, it's not really even known that resource doesn't exist. And so I think you had some awesome insights earlier, Emilia, about telehealth and telemedicine. I hope that is something that we can see integrated better using technology and seeking to address some of those complications there.
I think that the most exciting part about Foresight and what Foresight's vision is really thinking about the human equity condition first in healthcare, and not initially about the current structure of traditional medicine and healthcare. And I think if we start to do that with insurance companies, with doctors, I think that if we start to focus on health outcomes-based care and accessibility to care and the human condition first, and be willing to maybe even blow up or destroy the traditional construct, I think that is where we need to get buy-in from doctors and payers and psychiatrists, all of the people who are currently in the healthcare system. And that's bold, right? And that is uncomfortable, but it is needed. And so I think that's where we're going to have to go. And we cannot do it without walking hand in hand with healthcare providers, because it's going to change the way they serve patients. And I think if they don't buy in, then it's not going to get done. So those are going to be key voices in our process. And I think we will hear a lot of that at the national convening as we move forward.
And I think that's a beautiful last thought. And I'll just close. We are at a crossroads in our country. You mentioned, Emilia, at the beginning around the division, the kind of political divisions and philosophical divisions. One of the questions raised around economic challenges we will face coming out of COVID. And I think what Foresight is asking the question, this either will be an impediment to prevent us from having the types of conversations that you two just mentioned in your last comments, or it will be a catalyst. And I think that really is up to us. And we believe it can be a catalyst. And I think, just to echo where you just finished, Emilia, is if we start with humans and we start with that we all have a universal humanity and build to serve that, that then we actually will come up with a better and different set of answers, and we will solve some of the language issues. The resources will go and be prioritized to where they're needed. And we think at least we'll have the right conversation. So I think that's a great place and a hopeful place in 2020 to end this conversation. I want to thank you, Emilia and Alexis, and thank the Aspen Ideas Festival and the Aspen team, and thank all of you for participating today. Everyone have a great afternoon. Thanks very much.